There you
Hi
go.
everyone.
Good afternoon. So I'm a father of four. I have a young one, an infant, just under one. I have a child that's 3 years old. There is also my daughter, which is 9, and my oldest son, he's 14. Now, my concern is, and I'm bringing this to the attention of the pharmacist and the doctor here today. My concern is with regards to my children, when they suffer from a cold and flu. In the past, me and my wife have been very used to just providing them with the appropriate medication, so cold and flu medication, Duratas, things like that. And they relieve their symptoms, they allow them to sleep, and more importantly, they allow us to sleep. So in that manner, we've actually been able to manage their cold and flus and decrease the severity of them. But now the past year, me and my wife have been concerned, and we've had some trouble with dealing with this because we're not sure what to do since the new FDA recommendation of no cold and flu medication for children under 6 years of age. So like I mentioned, I have the infant and I have the other child. So they are both under 6, and I don't know what to do when they get sick. So I'm just trying to bring this to their attention and see their take on this, how they can help me in this scenario.
Okay, well, with doctors and healthcare professionals, you always have to keep updated on these new laws coming out and pretty much the safety and efficacy of everything else. It's important that you know what's safe for the child, because it's very, treating children is a delicate situation. You don't want to get anything wrong. All right. As a healthcare professional, it came to my attention that the cough and cold preparations, haven't been really shown to have any efficacy for the children, and also there is an increased likelihood of side effects.
So what kind of research is that? Because in my experience, it was effective with my children.
Yeah.
So was there a number of children in the studies, or
Yeah,
what can you tell me about
extensive research over the past 10 years has shown that for children under 6 years of age have shown no benefit when using cough and cold preparations. Okay, it's only brought to our attention just recently that children over 6 will find the most useful benefit out of these.
So it is a possibility that we just thought that the medication was helping, when really it was just the immune system that was battling the infection.
Yeah, that could be a
taking
reason.
over.
That could be a reason. Exactly. Exactly.
That does make a bit more sense, but it still doesn't address my issue. Besides just letting them battle it on their own and giving them a few Panadols, is there any other alternatives to this?
Well, that's where the pharmacist can come in and explain that.
As a pharmacist, been in the field for about 10 years, it's become a delicate situation, just because exactly what this father here, Mr. Green, was saying, that before he could treat his children with cold and flu medication, but for this reason now they've stopped that. Right now we actually are very limited in what we can give to children under the age of 6. There are a few medications on the market. There's nothing really that targets the cough and cold, but if there's things such as paracetamol and Nurofen, we generally recommend those for children.
And Nurofen can be given for children too?
Yeah, depending on the circumstances, but if they can take it, if they have those things like asthma and other conditions, we can give it to them, and that's part of our job.
For children 3 months and over.
There you go, for 3 months and over.
3 months and over.
That's
so
right.
even for my infant that's under 1, that's 11 months.
3 months and over, so it's fine.
That's fine.
Oh, okay.
Yeah,
I thought it had to be at least 1 year.
No.
fine.
So yeah, as our job as healthcare professionals, we have to give you the best medication suited for each individual patient. So if your child does have a fever, Nurofen or paracetamol, what we just said, it is important to keep hydration up. That's another main concern of ours.
Okay.
Things such as hydrolate is very good to give to children, and they can be given at any age. From my experience, the best thing are ice blocks. So slowly sucking on ice blocks.
They could help with the fever as well, actually.
Exactly right.
And also they enjoy them, so
Exactly.
easy.
Every now and then, I don't mind
Exactly.
snapping a hydrolate, keeping the fluids up. There's one more herbal remedy called Prospan. This is targeted for, I'm pretty sure it's a cough.
Yeah,
So
that's all right.
We'll just check the dosage of it.
Have a look.
Where are we? Yeah, so it's called an expectorant. So if your child does have sort of a chesty cough, so the mucus in the lungs, it helps break down that congestion and allow the child to cough it up.
And that's okay for children under 6 years of age?
Under 6 years, it's okay for children over 2 years.
Yeah.
Oh, okay. So it wouldn't be suitable for little Rachel.
Children to precautions.
Yeah.
It says here.
Yeah.
Okay, sounds good. So I think that does address my main concern.
For children under 2 years, you should seek medical advice before.
Exactly right.
Before administering any herbal remedies.
Exactly.
or anything like
Exactly.
If you think after 3 or 4 days that your child isn't getting better, it is best to go seek a doctor's
that.
opinion.
See a doctor, refer back to the doctor.
Refer back to the doctor. They might give you antibiotics to help treat that infection what they have. But it probably is best that you try to keep the fluids up, rest, those type of things before you give anything in particular.
Alright, that sounds good. So just to recap, I've been told if they do have a cold and flu and paracetamol isn't sufficient, Nurofen can be given to children that are above 3 months.
That's right.
Dosage is based on weight, I presume.
Yes.
Exactly.
Okay. And in other situations, generally we should always keep them well hydrated. So there's things like Hydrolate ice blocks, things of that nature. And you mentioned Prospan, is that the last one?
Prospan, with the herbal remedy.
Okay, but I'll probably have a bit, me and my wife, we like searching up stuff on Google.
Of course.
looking for,
Customers should always
literature.
do that with their children.
Yeah.
Especially if the children.
So I'm going to check up some literature reviews on that one, see how effective it is, because it could be good to have another alternative besides Nurofen and paracetamol. And hopefully we'll have the patients to deal with them when they're sick, and hopefully they'll be able to recover very quickly.
But fortunately, we have a parent like you who does stay up to date with this type of research and is concerned with their children. But at the same time, you do have your other parents who do. I'm sure you see this a lot. They just want something to treat the children's cough and cold.
Yeah, very common.
And they don't care if it's going to harm them or not.
That's a problem. They have given in the past, like you said, but at the same time, they do purchase it with, even though we do recommend not to take it. We do emphasize, as well the doctor has said, you do not want to give it to them because we do not want to increase the chance of any sort of serious side effect. So I think that's one of the main concerns that we're trying to say here between the three of us. Last thing for Dr.
I think that's
safety,
very...
safety first.
Exactly right.
Safety is always
the
first.
safety of your children is our main priority in the health profession.
Yeah, so it is very helpful that you put this to my attention and to other viewers.
That's our job.
Because now that because I still have some leftovers at home that I give to my older children, by now I know specifically not to give it to Rachel and Lucy that are under 6 years of age.
Yeah, that's right.
Yeah.
Okay, that sounds really great. Thank you a lot for your help. I think we've all benefited from this, and we'll see you in the next one.
See you guys.
See ya. Bye.